Hi, I'm Dr. Edwin Williams here to answer your questions in a fireside chat about rhinoplasty. One of the questions I'm asked all the time, they say, people say to me, you refer to yourself as a rhinoplasty specialist. What does that mean? Well, what it really means is you are someone who's passionate and dedicated to understanding rhinoplasty and delivering the best and most natural and safest results. Now, how do you achieve this? For me, when I was going through my training 25 years ago, I was passionate about rhinoplasty and I wanted to learn from the best. I was fortunate in that I had two mentors that were world-class mentors. One mentor that opened every nose, that was an approach that's used, and it's called open structure rhinoplasty, and the second mentor that did everything closed or endonasal. And then what you do is you trying to understand the principles of rhinoplasty, understanding what does it mean to have reducing projection, and refinement in the tip, and dorsal lines, and tip grafting, and really becoming a student of rhinoplasty and understanding the principles. And then what I did is, and I think it's very, very important, is to learn from other people. Learn from other people that have 20 and 30 years experience. I don't play golf necessarily because I'm just not that good at it, but to me, rhinoplasty is like playing golf. It is the ultimate and the most difficult thing to do and do well. It's the most difficult thing that I do. So the best thing to do is start learning from others. And then what I did is I became obsessed with learning from myself. Whenever I saw a patient, I would write down my plan, my exact plan on how I was looking to achieve reducing the profile, changing the projection, changing the nasolabial angle, and then putting together that surgical plan, and then the day of executing that plan, and then reflecting back upon what I did when I was doing my surgery. I take intraoperative photographs of our patients as they are on the table. I also have a schematic where I very, very precisely diagram exactly what I have done to a patient and what I didn't do. And then I follow them out. I don't just see a patient once in a week or a month. I see them at 3 or 4 months, and then again at 6 to 8 months, and then again at a year. And then a lot of patients will come back for other things. And what I like to do is I look back at my old photographs. In fact, once a year I try to get in a dark room and look at all of my before and after photographs and learn from myself. So the next step to being a rhinoplasty specialist is really becoming a teacher. I've gone to the cadaver lab, worked with our surgical residents, as well as teach on a national level and publish about rhinoplasty. So why do I find it's the most gratifying thing to do? Because if you think about it, it makes perfect sense. It is right in the center of your face. And as a result, when you do a really good job, you have a really happy patient, you've really made a big difference and impact in the way they feel about themselves. Not just the way they look, but the way they feel about themselves. That's why I find rhinoplasty the most gratifying thing. I put together a little book. It's called Rhinoplasty, Everything You Need to Know About Fixing and Reshaping Your Nose. It's available on Amazon, and all the proceeds of this go to victims of domestic violence. So thanks for watching, and I hope I answered some of your questions about what does it mean to be a rhinoplasty specialist.